My name's Caroline, and I'm going to go through medication administration with you today. A few things before we start. You'll want to make sure that you go in and identify the patient with the 2 patient identifiers, name and date of birth. You'll also want to make sure that the patient doesn't have any allergies. You'll want to wash your hands, put on gloves, provide privacy. You'll also want to make sure that you are taking the 6 rights of the patient seriously, and that you know all 6 rights. The patient is the most important, getting the correct patient. We are going to start with PO medication. So you have pills, tablets that you'll want to make sure that you give to the patient individually in different cups. You won't mix them all in one cup. You'll want to make sure that the patient, you'll want to stand by the bedside and make sure that the patient is swallowing the medication and isn't pocketing the medication in his or her mouth. The enteric-coated capsules are capsules that you want to make sure that you do not crush, and extended release as well. There's also liquid medications that you will give, and that is it on that. We have buccal medication that is in the lining of the cheek, the mucosa of the cheek, and there's also sublingual medication that's going to go underneath the tongue. Both of those you'll want to make sure that they dissolve on their own. You won't want to chew them or swallow them, and you'll want to make sure that you rotate the site of the buccal and sublingual medications, especially to eliminate any breakdown of the mucosa lining. We also have eardrops. Eardrops you'll want to put in the patient's ear by pulling the ear up and out. And you can put cotton balls gently in the patient's ear and keep the patient on the side if able, to keep the medication inside the ear canal. We also have eye drops. Eye drops you'll want to pull down the lower lid of the patient's eye and then place the eye drops into the bottom area of the eye, making sure that the dropper does not touch the eye. You'll want to make sure that you tilt the patient's head back a little bit as well to make sure that all the medication does stay within the eye. Okay, moving on to, we're going to talk about injections. So we'll start with subcutaneous injections, and a good example of a subcutaneous injection is the insulin injection. So insulin injection, you'll want to make sure that you use an insulin syringe. Insulin's measured in units. Insulin is going to go into the patient's stomach. You'll want to make sure that you pinch a little bit of the the adipose tissue, and then you'll inject the insulin into the adipose tissue into the skin, and then you will want to make sure that you rotate sites when you're providing insulin medication. There's also the tuberculosin needle, which is primarily used for TB testing. This is going to go into the skin at a 15-degree angle, and you'll want to make sure that you use a tuberculin needle for that injection. Going back to subcutaneous, those injections are going to be administered at a 45-degree angle. We also have IM injections. IM injections you're going to do in deltoid, the gluteal, or the vastus lateralis muscle. You will want to make sure that you pick the most, depending on the patient, the correct muscle to administer that injection to, because you want to make sure that you do not hit bone. There are syringes, gauges go from anywhere from, this is 18 up to 25. The higher the number, the smaller the gauge. The lower the number, the higher the gauge. You want to make sure that you are using the best syringe for the amount of medication that you're going to be injecting. You want to make sure that you're not using a syringe that is too big for a small, precise amount of medication that you're going to be administering. When you do administer, when you are going to go do an injection, you want to make sure that you fill the syringe first with the same amount of air as you are going to use for the medication. So if the physician prescribed 3 mLs of medication, you're going to make sure that you would draw 3 mLs of air first. You would administer it into the vial, but before you do that, you're going to make sure that you really wipe down the top of the medication, the top of the vial, with alcohol. So once you put the air into the vial, then you're going to be able to withdraw that same amount of medication. But wiping the top of the vial with alcohol is very important to do that first. When you're done giving injections, you want to make sure that you do not cap the needle. You will then, and you won't touch the needle, you will make sure that everything goes inside the sharps container. Some medications do come in glass ampules. The medication will be at the top of the ampule. You want to make sure that when you break the ampule, you put gauze over the top of the ampule when you're breaking it. So you'll crack the ampule open, and then you'll want to make sure that you use a filtration needle, which will help to remove any particles of glass that could have gotten into the medication when you were breaking the ampule, and then those teeny particles will not be administered into the patient when you're giving the injection. There are a few other methods of administration. We have like vaginal and rectal. They most of the time the patient will do them on their own if they're able, just because it is a little bit more intrusive and just for their patient's own personal privacy. And I think that is about it.